This program is proudly brought to you by Daytech PNG Limited and Telecom Limited.
Good night, Papua New Guinea. I'm Malcolm Wira, and welcome to another episode of Infocus. Tonight, we hold discussions with the PNG Cancer Foundation. We discuss the prevalence of cancer in Papua New Guinea, as well as the great initiatives, programs, and partnerships which the PNG Cancer Foundation is running. Joining us for discussions in the studio tonight, we have Ms. Priscillar Napoleon, Executive Manager for the Papua New Guinea Cancer Foundation, and Dr. Linda Sirigoi, Deputy Chair for the PNG Cancer Foundation. Ladies, thank you for joining us.
Thank you for having us.
Yeah, it's a pleasure to be here.
Firstly, just from the outset, Dr. Sirigoi, can you define what is cancer and the main types of cancer that are prevalent in Papua New Guinea?
So cancer is the Latin word for crab. So cancer refers to a group of diseases, and it usually depends on where the disease starts. For example, if cancer starts in the breast tissue, we call that breast cancer. If it starts in the bone, then it's bone cancer. Or it could start in the liver, and that's liver cancer. Cancer could then spread from the original site, for example, the breast, to other parts of the body, such as the lungs or the liver. So the main types of cancers that we have in Papua New Guinea, heading the list would be breast cancer, followed by the oral or mouth cancer. Then we have the cervical cancer, and then we have the stomach cancers and liver cancers. So cancers are a result of abnormal cell growth. So normally we have trillions of cells in our body which normally divide and then die off, and the body has the ability to clear that out. So what happens with cancer is, for some reason or some trigger, the body is not able to do that. So the cells start to grow in an abnormal way and then take over the growth of normal tissue, and that's how cancer develops. So that's very explained in very simple terms what cancer is.
Priscilla, the organization you had is the Papua New Guinea Cancer Foundation. Could you explain the history and the core missions of the PNG Cancer Foundation?
So the PNG Cancer Foundation is an NGO. We are based in Port Moresby in Papua New Guinea, and it was formed with the vision to minimize the threat and impact of cancer through the coordination of cancer education, public health programs throughout the country. So this is carried out by raising awareness through our school programs and community programs that are located in various locations in PNG. Cancer Foundation's vision is mandated by the National Department of Health through its National Cancer Policy 2015, which supports the cancer priorities from 2017 to 21, and that shows us as a key local stakeholder, basically focusing on primary prevention and advocacy on screening and the message of early detection.
I understand your organization is engaged in two specific aspects of addressing cancer prevalence in Papua New Guinea. You briefly mentioned them. Could you elaborate on the two specific ones?
As Dr. Sirigoi has mentioned, we raise awareness on the prevalent of the common cancers that affect Papua New Guineans, which he has mentioned on oral cancer, breast cancer, as well as cervical cancer. So since Cancer Foundation's inception in 2014, we have developed programs that support these cancer programs, and the aim of these programs really is to address and empower healthy lifestyle choices as a first step to lowering an individual's risk of getting cancer or certain types of cancer. And this is, as Dr. Sirigoi mentioned, the three main cancers. And if Doctor would like to elaborate on this.
Main role of the Cancer Foundation is to advocate and create awareness. I think it's very important that, especially when you're talking about diseases such as cancer or the other non-communicable diseases, getting the information out there to the public is very important. Not only that, prevention is very important, and we know that at least even up to 80% of cancers, or what we refer to as lifestyle diseases, non-communicable disease, can be prevented. And so that is why it's very important that information is made available to the public so that they are able to make informed and wise choices regarding their health.
I understand prevention there. It's referred to as the primary prevention methods. Could you elaborate on them?
Yeah, okay, so if we take a step back to what causes cancer, there's several reasons or several causes that can cause cancer. We normally refer to them as risk factors. We know that age is a risk factor, being overweight is a risk factor, being exposed to toxins in the environment, usually referred to as carcinogens, can cause cancer. The thing with prevention is to avoid the source or the cause of the disease. So if we're talking about cancer, then you look at what are the causes or the risk factors. So I mentioned age. So with age, you really can't do much about that. We can't. But the other factors such as weight, exposure to carcinogens, so those come back to things like alcohol, smoking, cigarettes, the chewing of betel nut, exposure to infections such as the hepatitis B infection or the human papilloma virus infection. Those are two viruses that we know are responsible for causing cancer. So the hepatitis B virus causes liver cancer, and the human papilloma virus or the HPV virus we know causes cervical cancer. So if you're talking about prevention, what you do is you want to avoid exposure to the agents that cause cancer. So again, it would be coming back to, not smoking, not drinking alcohol, maintaining a healthy weight. We know that obesity is a risk factor for cancer. The more weight you carry, the more likely that your risk of developing cancer. We know that in particular with women who carry a lot of abdominal fat, that becomes a risk for breast cancer because you store a lot of estrogen. So estrogen is one of the female hormones which is implicated in breast cancer. So that's why you can see that direct link there with being overweight in women and the risk of having breast cancer. Lifestyle diseases. I think cancer, when I was a medical student, cancer used to be a disease that was seen just with the older generation or the older folk. Nowadays, cancer is, well, our current statistics in Papua New Guinea say 1 in 10 people will have cancer. So basically what that means is if you're in a room with 10 people, at least one person in that room is likely to develop cancer through their lifetime. So what we've seen with, not just in Papua New Guinea, but I think it's a global trend, is the lifestyle and the diets, which are the main contributors to cancer. So we know now that it's, a lot of the research shows that having very high sugar diets, I think that is one of the major factors that contributes to cancer in, well, globally, and more so in Papua New Guinea. We see that our diets have changed from our traditional diets to adopting a Western diet, which is very rich in processed foods, inflammatory foods such as sugar, white flour, and vegetable oils. And these are the three main foods that are implicated in not just cancer, but the non-communicable diseases, which includes diseases such as high blood pressure, strokes, asthma, diabetes. So cancer actually falls within this category of NCDs, or non-communicable diseases. So these are diseases that cannot be passed from one person to another. So they're non-communicable diseases, whereas if you have diseases like tuberculosis, that can pass from one person to another, whereas somebody has diabetes, I'm unlikely to pass diabetes on to Priscilla unless she's got a lifestyle that puts her at risk of that. So coming back to the prevention, so if it's lifestyle, then we've got to have a lifestyle that is healthy diets, a diet that is cutting out all your processed food. Come back to our natural, diets. We need to be going back and eating our natural foods.
Thank you, Dr. Sirigoi. We now take a quick break. Join us on the other side as we continue our discussions with the PNG Cancer Foundation. Welcome back. You're watching In Focus. We continue our discussions with the PNG Cancer Foundation. Priscilla, could you explain the workshops that you run in the individual provinces? I understand you recently returned from running one in Leh.
Yes. So in 2016, PNG Cancer Foundation expanded its outreach programs, and this is to include the younger audience, which is the school-aged youth. So our programs focus on what cancer is, the early signs and symptoms to look out for, and what preventative lifestyle changes that can be made to reduce cancer risk. Over 8 years of operations by the PNG Cancer Foundation, we had reached out to over 11,000 participants in more than 12 provinces, reaching out again with the consistent message of cancer prevention, which is prevention is better than cure, and by this way hoping to impact the younger population through our programs. And these are called the Healthy Teens program. So Healthy Teens program is a school-based program. Mainly the message that is shared at the school program is on healthy lifestyle and empowering the young kids or the students to make healthy lifestyle choices. And the main objectives that we'd like them to take away is the main messaging, which is eating healthy, exercising regularly, don't smoke, don't chew, and exercising regularly. We also have another program called the Cervical Cancer Education Program, and this is to promote girls' reproductive health in the schools, and this is targeted at the older audiences between grades 9 and 12. So the aim of this program is to really help the young ladies to learn about prevention at an early age. The other one is the Triplaman Outreach Prevention and Education Program. So this is focused to the menfolk. This is a new program that we launched 2 years back to focus mainly on men's health, because we as a foundation have realized that earlier on we have started and conducted programs that focus mainly on raising awareness on women's health. So this was a way to leverage and really help to start the conversation among the menfolk. The third one is the Community Outreach Prevention and Education Program. This one is conducted in the communities where we visit the rural areas. And again, it's the same messaging of early detection and screening, and also educating our people out there about the prevalent cancers. If Doctor would like to add on to that.
It's important to have these workshops and programs happening out in the community, and again to re-emphasize my point about awareness, the importance of having information out there. The focus initially was on cervical and breast cancer, and that's largely because if we look at the prevalence of the type of cancers that are in Papua New Guinea, those were our two most common cancers. So cervical and breast cancer, followed by the mouth cancer. And of course now we're seeing a lot more of prostate cancer, which is a male's cancer. So, and then we're also seeing a lot of the stomach cancers or bowel cancers. So you'll have to pardon me for using the words a lot more and not having any specific data, but because that's a challenge that we continue to have, not having accurate data or a means of collating data on cancer statistics. And one of the reasons is that we don't have a cancer registry, and so we don't have a system where we can then anybody can go and refer or pull out the information that you need regarding the incidence or prevalence of a certain disease. And that's something that's been worked on, but I think for now getting the information out there through the workshops and the awareness programs that the foundation does is a very important role and activity of the foundation.
Thank you, ladies. We now go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching Infocus. We continue our discussions with Ms. Priscillar Napoleon and Dr. Linda Sirigoi, both from the PNG Cancer Foundation. Dr. Sirigoi, can you discuss how your organization engages and coordinates with the National Department of Health in its implementation of its programs, specifically in the cancer sector?
As you know, the PNG Cancer Foundation is a non-governmental organization, and the activities is funded a lot, or basically from donors. So we have a lot of donor partners who support the activities, also through fundraising drives and the corporates. So in association with them, we don't actually have any specific funding at the moment that comes from the government. However, the foundation works with the Department of Health, largely with the Public Health Department, the desk, and the Cancer desk in the department to again help with the promotion of health messages. We're also involved in facilitating meetings that involve cancer with the department. Recently, the Cancer Foundation hosted the Cancer Stakeholders Meeting in 2022. So that was done in partnership with the National Department of Health. So the Cancer Foundation has been recognized by the department as a national expert in cancer public health programs by civil society. We've also participated with the HPV program, so that's a human papilloma virus vaccination program. So if you remember, I talked earlier about one of the preventions of cancer, in particular cervical cancer, is the HPV vaccination. So there was a trial of HPV vaccination conducted in the National Capital District, and so the Cancer Foundation was also a partner in that program.
I understand there are some private sector partners as well. Could you elaborate and give us some examples of private sector companies that have assisted the Cancer Foundation?
We are thankful to our friends from the private sector because they almost support 80% of the work that we do through our fundraising efforts. So we are thankful to a lot of our big supporters, such as ExxonMobil and Santos, more printing as well. So certain supporters and sponsors come on board to support different areas of the foundation where they feel they can support. So it is really a cross-cutting. It's wherever they see fit to support us, whether it's monetary or non-monetary. We get a lot of support around the clock to support our outreach programs that we conduct in various locations in PNG.
I understand your organization is, as with a lot of the NGOs in Papua New Guinea, is faced with some challenges. Could you give us some examples of the specific challenges your organization is confronted with or has been challenged with?
Yeah, I believe this one will be the notable one for many, mainly NGOs or civil societies, not just in PNG but globally, is really the lack of funding to support many of our programs. And as Dr. Sirigoi has mentioned, the Cancer Foundation is really supported a lot by the corporate sector. So we get minimal support from the government. Not saying that they don't help us, but they do support in little areas that they see fit to support us through the National Department of Health. So I would say the financial constraints is one of our biggest challenges, because we would like to do a lot more with the implementation of the public health programs that we run for the different demography of the audience that we target through our programs. However, that cannot be done because of this constraint. The other one is the limited training capacity. So again, maybe that may be tied to the first point that I mentioned. Maybe this is to do with monetary or financial support. But this is one of the areas that we see training would be good for a lot of our staff and the human resource to upskill, because cancer and the research and everything that is trending around for the purpose of this interview is trending around cancer. There are a lot of new research coming up, different ways, different methods, different treatments. So when we upskill, we learn new ways that the world is implementing around the cancer space. The other thing is the organization does lack sometimes technical expertise. Therefore, we are thankful to Dr. Sirigoi and a lot of our board directors who volunteer their time with their technical expertise, because the foundation does not have that kind of support, financial support, to bring in a lot of technical people to, expertise to run these programs. So we are very, very thankful to many of our partners, our stakeholders, such as the doctors from the Port Moresby General Hospital, and even in Lay as well, who come on board to volunteer and give us this technical expertise, especially when we are conducting our programs.
Thank you, Priscillar. I understand another challenge that your organization faces, the lack of adequate and accurate data sources related to cancer. Dr. Sirigoi, could you comment a bit on the challenges around accessing reliable data?
Yeah, thank you. So I believe that's a common challenge, so not just to the Cancer Foundation, but I guess to a lot of other organizations, and in particular in health, is having reliable data collection systems. So that's one area that would like to see improvements in. We don't have anything in terms of research, and that is probably something that we would like to see in the future with working with the government, because if we're able to then have some research program in place that would then help in the collection of data, not just in terms of statistics, but information that would be relevant or more local, local for us and relevant to the cancers that we have within Papua New Guinea.
Finally, Priscillar, could you highlight for us how the public can support your organization?
Firstly, thank you so much. And again, the message of cancer prevention is the main objective that we always like to get out there, and hope that when we conduct our programs, that people take this message away. The public can support by engaging in outreach campaigns and programs. This is when you reach out to the foundation and ask that you would like to host an awareness session, whether it's in your office, in your community, in your village, depending on your setting. This we refer to as a local champion. So you taking up the initiative to be a change agent in your community by starting the conversation of cancer prevention. The other way you can support is through volunteering. We have volunteering in different areas at the foundation that you can support too, even through sponsorship of various outreach programs that we conduct that may suit your organization or you as an individual who would like to support. So there are many ways that you can support. So you can always feel free to reach out to the Cancer Foundation on the details provided, and then someone can support from there.
Okay. Thank you, Priscilla. Unfortunately, time has caught up with us. Before we go, I'd like to take this time to thank our special guest, Ms. Priscilla Napoleon, Executive Manager for the Papua New Guinea Cancer Foundation, and Dr. Linda Sirigoi, Deputy Chair for the PNG Cancer Foundation. Ladies, thank you for joining us.
Thank you for having us.
Thank you.
Thank you for joining us, and do join us again next week Monday on our regular time slot of 7 p.m. Till then, good night.
This program was proudly brought to you by Daytech PNG Limited and Telecom Limited.